It doesn't always start with chest pain. For many people, especially over 50, the first sign of a heart attack isn't what you think. It's a silent, subtle signal your body whispers days, or even weeks, before the real danger strikes. And too often, it's brushed off or misread. This video could be the one that saves your life, or the life of someone you love. Please don't ignore these early signs. If you've ever worried about your heart or know someone who's had a scare, hit subscribe, like, or share your story in the comments. You never know who you might help by spreading real awareness. Every sign matters. Unusual fatigue or a feeling of heaviness in the chest can be one of the earliest and most overlooked signs that your heart is in distress. For many people over 50, this type of fatigue doesn't feel sharp or alarming. Instead, it feels like a deep, lingering tiredness that sleep doesn't fix, or a dull weight pressing on the chest that comes and goes. It's easy to dismiss it as part of getting older, or to blame it on stress, poor sleep, or a busy day. But this kind of exhaustion may be your heart signaling that it's struggling to pump efficiently. Doctors have noted that in the days or even weeks before a heart attack, patients, especially older adults, often report unusual fatigue that doesn't feel normal for them. It might show up as difficulty walking short distances, needing more rest than usual, or feeling drained after simple tasks. When the heart isn't getting enough oxygen, the body diverts energy to protect vital functions, leaving you feeling weak or worn down. Chest heaviness, especially if it's new or different, is another red flag. It may not feel like the crushing pain people associate with heart attacks. Instead, it might feel like pressure, tightness, or discomfort that lingers or gets worse with exertion. These symptoms are often missed because they're subtle, but they're important. If you notice a pattern of fatigue that's out of the ordinary, or a chest sensation that's new or nagging, don't ignore it. It may be your body's quiet call for help, one that deserves immediate attention. Unusual fatigue or a feeling of heaviness in the chest can be one of the earliest and most overlooked signs that your heart is in distress. For many people over 50, this type of fatigue doesn't feel sharp or alarming. Instead, it feels like a deep, lingering tiredness that sleep doesn't fix, or a dull weight pressing on the chest that comes and goes. It's easy to dismiss it as part of getting older, or to blame it on stress, poor sleep, or a busy day. But this kind of exhaustion may be your heart signaling that it's struggling to pump efficiently. Doctors have noted that in the days, or even weeks before a heart attack, patients, especially older adults, often report unusual fatigue that doesn't feel normal for them. It might show up as difficulty walking short distances, needing more rest than usual, or feeling drained after simple tasks. When the heart isn't getting enough oxygen, the body diverts energy to protect vital functions, leaving you feeling weak or worn down. Chest heaviness, especially if it's new or different, is another red flag. It may not feel like the crushing pain people associate with heart attacks. Instead, it might feel like pressure, tightness, or discomfort that lingers or gets worse with exertion. These symptoms are often missed because they're subtle, but they're important. If you notice a pattern of fatigue that's out of the ordinary, or a chest sensation that's new or nagging, don't ignore it. It may be your body's quiet call for help, one that deserves immediate attention. Shortness of breath that comes on suddenly or feels out of place, especially without any real exertion, is a warning sign that should never be ignored. If walking across the room, climbing a few steps, or simply talking leaves you feeling winded, it's not always about your lungs. Often, it's your heart struggling to pump efficiently, causing fluid to back up in the lungs or reducing oxygen delivery throughout the body. This kind of breathlessness is one of the most commonly ignored signs of an impending heart problem, particularly in older adults. It may feel like you're breathing through a straw, or like your chest is tight even when you're at rest. Because it doesn't always come with pain or pressure, Many people assume it's just fatigue, aging, or anxiety. Cardiologists stress that shortness of breath, especially if it's new or noticeably worse, can signal that your heart is not circulating blood the way it should. This can be due to narrowed arteries, weakened heart muscle, or even the early stages of heart failure. It's not about being out of shape. This symptom can strike even those who regularly exercise if something has changed in their cardiovascular system. If breathing suddenly feels harder and there's no clear explanation, it's critical to listen to that signal. Your body is trying to tell you something important. Don't wait for chest pain to take it seriously. When breathing changes unexpectedly, your heart could be the cause, and it may need urgent attention. Nausea, indigestion, or stomach discomfort can easily be mistaken for a minor gastrointestinal issue, especially after a heavy meal or during times of stress. But for many people, especially women over 50, these symptoms may actually be early warning signs of a heart attack. The sensation might feel like bloating, a sour stomach, mild nausea, or even heartburn. Because it mimics typical digestive problems, it's often dismissed or treated with antacids while the real issue, heart trouble, goes unrecognized. Doctors warn that the nerves around the heart and digestive tract are closely linked. When the heart is under stress or not receiving enough oxygen, it can send signals that feel like stomach upset. In fact, research shows that women are more likely than men to report nausea or abdominal discomfort as part of their heart attack symptoms. This has led to far too many cases where the true cause of the distress is overlooked until it becomes a crisis. The danger is in the delay. If what feels like indigestion is accompanied by other symptoms, like fatigue, shortness of breath, cold, sweats, or lightheadedness, it should raise immediate concern. Even if the stomach discomfort stands alone but feels unfamiliar or unusually intense, it's worth investigating. Trusting your gut isn't just a phrase. It's a literal warning system in cases like this. Don't wait or assume it's just something you ate. When the stomach feels off without a clear cause, your heart may be the real source of the problem. Cold sweats, sudden dizziness, or feeling lightheaded are often brushed off as signs of stress, dehydration, or a skipped meal. But they can also be your body's way of signaling that your heart is in trouble. When the heart isn't pumping blood effectively, circulation drops, and the brain and other vital organs may not get the oxygen they need. That's when the body sends a warning, often through symptoms that seem subtle or easy to explain away. Doctors note that these symptoms are especially important to watch for in adults over 50, where they may precede a heart attack without any chest pain at all. Cold sweats, where the skin suddenly feels clammy or you begin perspiring without physical exertion, can be a red flag that the nervous system is reacting to heart distress. Likewise, lightheadedness can mean that blood pressure has dropped suddenly due to poor heart function. These signs are commonly mistaken for anxiety, especially when they come on during rest or in moments of emotional strain. But the body's physical response is different from stress alone. If dizziness, faintness, or sweating hits unexpectedly and doesn't pass quickly, it deserves urgent attention, particularly if combined with nausea, unusual fatigue, or discomfort in the chest, back, or jaw. It's not overreacting to take these signals seriously. Cold sweats and lightheadedness may not be dramatic symptoms, but they are your body's early alarm, and in many cases, they're the only warning you'll get before a serious cardiac event. Mild chest pressure can be one of the most easily ignored signs of a heart attack, precisely because it doesn't feel like the dramatic pain most people expect. It might feel like someone is lightly sitting on your chest, or like a belt has been tightened around your upper torso. Some describe it as fullness, tightness, or simply discomfort that comes and goes. Because it's not sharp or overwhelming, many brush it off as indigestion, anxiety, or muscle strain. But cardiologists warn that this kind of subtle chest pressure, especially when it's new or unexplained, can be an early sign that the heart isn't getting enough oxygen. The discomfort may come during rest or mild activity and often passes quickly, giving a false sense of reassurance. That's the danger. When the heart is struggling, it doesn't always scream. Sometimes it whispers. This sensation is particularly important to watch in older adults, where symptoms tend to be less dramatic than in younger people. It's also more common for women to experience these milder forms of chest discomfort instead of the stereotypical crushing pain. If chest pressure is accompanied by shortness of breath, fatigue, cold sweats, or pain in the arms, jaw, or back, it's even more urgent to act. But even on its own, it should not be ignored. Waiting for severe pain could mean waiting too long. Mild or not, when your chest doesn't feel right, your heart may be telling you something critical. Sleep disturbances in the days leading up to a heart attack are often overlooked, yet they may be an important warning sign. Many people report difficulty falling asleep, frequent waking, vivid nightmares, or a restless night's sleep shortly before experiencing a cardiac event. While scientists have not fully determined the exact cause of this connection, research shows the pattern is too consistent to dismiss. One theory is that the heart's stress triggers changes in the nervous system and hormone levels, which then disrupt normal sleep cycles. Elevated stress hormones like cortisol can increase restlessness and anxiety, making it harder to achieve restful sleep. Poor sleep quality, in turn, further stresses the cardiovascular system, creating a dangerous cycle. Doctors emphasize that if sleep suddenly becomes troubled without an obvious reason, especially alongside other subtle heart symptoms, it should raise concern. Sleep problems alone don't mean a heart attack is imminent, but they can be a clue that something serious is developing. It's important to listen to your body and note changes in sleep patterns, particularly if you have risk factors for heart disease or notice other warning signs. Talking to a healthcare professional about new or worsening sleep issues could help catch a heart problem before it becomes critical. Ignoring these sleep disturbances may delay diagnosis and treatment, making early awareness and action essential. Swelling in the legs, ankles, or feet is often dismissed as a normal part of aging, or the result of standing too long. However, persistent swelling in these areas can be a warning sign that the heart is not effectively circulating blood. When the heart's pumping ability weakens, fluid can build up in the lower limbs, causing noticeable puffiness and discomfort. Doctors caution that this swelling, known medically as edema, is more than just a nuisance. It may indicate that the heart is struggling to keep blood moving, leading to fluid accumulation. This symptom can appear days or even weeks before more serious heart problems develop. Because swelling is so commonly attributed to harmless causes, it often goes unreported or untreated. But paying attention to new or worsening swelling, especially if it does not improve with rest or elevation, is important. It may be accompanied by other subtle signs such as fatigue or shortness of breath. If swelling is persistent or severe, it's crucial to discuss it with a healthcare provider. Early recognition can lead to interventions that support heart function and prevent complications. Don't assume swelling is just part of getting older. Your heart health may depend on noticing this sign and acting on it promptly.